Good afternoon, everybody. Just following on from Kevin's, always a bit of a challenge, but also I think it also serves to inspire me a little bit about the task ahead and what we can do about it working together. And being here this morning and listening to Jonathan Bimpey and Jane talk about what's going on across London and the innovative practices at a local level fills me with enthusiasm and actually reasserts my determination that we can do something working together to tackle this wicked problem. And you know, I think there's certainly lots of experience, enthusiasm and energy in this room. And just reflecting on the energy bit, we've all just eaten a hearty lunch and it's been a long day, you've all been sat down, so I'd just like you to bear with me for a minute or so and just to gently get up off your seats, look around you, make sure that you're not going to barge into anybody. Wouldn't want anybody to get injured. So that's good, everybody's up. So I just want just roll those shoulders back, please. You know, not too strenuous after lunch. Just get those back muscles going, and then just roll them forward a little bit. This is all my football coaching stuff coming out. And then just give them a little shake. Not too strenuous. I don't want anybody to pull any muscles. PHE's liability insurance doesn't stretch that far, I don't think. Okay, you can all sit down. Thank you for bearing with me on that. But you know, tackling poor diets, inactivity, and obesity is something that we can only do working together. We've heard a lot about the importance of that this morning. This afternoon, I think we'll reinforce that. We'll be asking you to feed back to us and provide us with your inspiration and your experience. But without further ado, I'm going to hand over to my colleague, Sam Montel, to really kick off this session. Sam.
Thank you, Jamie, and good afternoon. As Jamie's introduced, I work in the Obesity and Healthy Weight team, and I'm a registered public health nutritionist. And I'm going to start this afternoon's session, and I'm hopefully going to press the right key. The Diet and Obesity team at PHE are holding these local engagement events around England to speak to and listen to you, and to help inform PHE's Diet and Obesity work plan. As a bit of a reflection, PHE is now 7 months old. And as you've just heard from Kevin, there are a number of key challenges around tackling poor diets and obesity. These are priority areas for us, working with you and through our PHE centres and regions. So this afternoon, we are looking to provide you with an overview of the work of the Diet and Obesity team and obtain your insights, to discuss your support needs and how best you can utilise PHE's assets to improve dietary health in local populations, to consider the nature of the challenges and the opportunities to local action on diet and obesity, and to inform the development of local and national diet and obesity strategies. And importantly, to come together to build networks and a shared commitment to tackling these important issues. So, a quick recap for those of you who are new this afternoon. PHE is a expert national public health agency which protects health, addresses inequalities, and promotes the health and well-being of the nation. Duncan Selby is the Chief Executive, and Kevin is the Director of the Health and Wellbeing Directorate, where the Diet and Obesity team sit. The Health and Wellbeing Directorate leads PHE's work to improve health and wellness, address the major drivers of disease, disadvantage and death across England. We've talked about the priorities this morning, and to reflect again that there are 5 PHE priorities, with one of these high-level priorities recognising the importance of tackling obesity and poor diets. As you can see, PHE is looking to tackle the causes of the causes by helping people to live longer and more healthy lives, by reducing preventable deaths and the burden of ill health associated with smoking, high blood pressure, obesity, poor diet, poor mental health, insufficient exercise and alcohol. And looking at where local authorities fit in. PHE has 15 centres based across 4 regions. These centres work at a local level with local authorities to support them in achieving their local priorities. PHE has a national presence based in London to support these centres in these regions. And looking at the diet and obesity team, there are 4 teams within it. So nutrition science, supporting the work of the Scientific Advisory Committee on Nutrition, the nutrition surveys and food composition team, so collecting data on dietary intake through the National Diet and Nutrition Survey, Obesity and Healthy Weight team, where the 3 of us sit, coordinating the development of PHE's work plan on obesity, and that includes supporting and advising PHE centres and local authorities, and the nutrition advice team, providing nutrition advice across PHE, Department of Health, and across other government departments. So turning to the impact of poor diet. Well, this slide shows the various factors that impact on mortality. The ones that are circled are those which have a dietary influence. This demonstrates the key importance of changing the dietary behaviours of the population. Poor diet and its consequences, including overweight and obesity, cardiovascular disease, diabetes and some cancers, mean that diet is one of the key priorities for public health to tackle. We know that the majority of people in England do not eat a healthy, balanced diet as depicted by the Eat Well plate, nor do they achieve the government's dietary recommendations. And it's interesting to look at where the population are at right now nutritionally. Now, this is a complex slide, but it actually illustrates, with no surprises, that intakes of saturated fat and sugar are above recommended levels, and fruit, vegetable and fibre consumption are below recommendations. In summary, we eat too much salt, saturated fat and sugars, and not enough fruit, vegetable, oily fish and fibre. We all know that poor diet and lower levels of physical activity are major causes of premature mortality in England. It is estimated that 70,000 deaths, premature deaths, would be prevented if in the UK, if nutritional recommendations on salt, saturated fat and added sugars were achieved. My last slide shows the stark costs associated with obesity and poor diet, familiar to us all, I'm sure, and as well as the projected costs here set out in the Foresight report. I'm now going to hand over to Penny, and she's going to take you through the prevalence of obesity and the developing PHE work plan.
Thanks, Sam. Good afternoon. So what about obesity and where are we? Well, I'm sure this is no surprise to you all, but this Health Survey for England data from over the years shows a steady upward trend since the early 1990s, with 2/3 of English adults being overweight and obese. So looking at the data at a regional level, this Health Survey for England data shows where London sits in terms of obesity prevalence among adults compared with other regions in England. And moving on to children, as most of you have heard in this morning's session, childhood obesity is increasing. And this slide shows regional National Child Measurement Programme data from 2006-7 to 2011-12. And obesity prevalence in London is higher compared to the average figures for England. Looking at Year 6 data over the same time period, obesity prevalence in London is again higher than the average figures for England. But also this data shows that all regions are showing an increase in obesity prevalence in Year 6 children over this 5-year period. So this data on diet and obesity really reinforces the issue. And the Department of Health published its call to action on obesity, and Public Health England shares this national ambition. Public Health England will work with local and national partners to achieve a downward trend in excess weight among children and adults by 2020. So, what is Public Health England doing about this? Well, currently Public Health England is developing its obesity programme and involving a range of the following teams. Won't go into all of them or read them all out. And it's pulling together a wide range of intelligence, enthusiasm and dedication across these teams. You know, it is PHE's responsibility to pull this information together and provide a cohesive and joined-up picture on diet and obesity, with these local engagement events really helping to feed into this obesity programme. Well, how are we going to deliver this work? Well, PHE will be taking a life course approach, working with a broad coalition of partners, both nationally and locally, and acting as a source of expert scientific advice. We have at our hands a huge amount of scientific advice and evidence, and we need to work out how best to structure this to suit your needs and work for you. Developing best practice guidance support for local planners and healthcare professionals or public health professionals. And just last week, Public Health England produced 2 guidance documents around obesity in the environment, one looking at regulating the growth of fast food outlets and the other increasing physical activity and active travel. We'll also be aligning with the government strategy on diet and obesity. This will enable us to implement and scale up effective interventions, and also using Public Health England's assets to work nationally to encourage positive behaviour change and using, for example, the Change for Life campaign. It's important to note that, as obviously Kevin mentioned in his welcome message, that we're committed to exploring a step change in how we tackle obesity. And we also acknowledge that there are no silver bullet solutions, and that action will need to be wider than the current status quo to ensure that not more of the same is achieved. So this rather busy slide just shows the breadth of activity underway. By no means it's not an exhaustive list. Down the left-hand side we have all the teams that are involved, and across the top the life course approach. I'm not going to go into all of them. Just focus on a few. Public Health England is currently jointly working with NHS England to review the obesity care pathway, and also working on ensuring dietary advice is consistent and understandable, and then doing this through, for example, the NHS Choices website, and sharing data on how best to present this, and obviously Caroline and Hal will touch on this in more detail. We're also currently updating old Department of Health and Food Standards Agency guidance on public procurement and catering, and looking to publish this in January 2014. The guidance is looking at healthier and more sustainable food procurement, and we're also looking to run some workshops in February next year. So if you are interested in attending those workshops, please just come up to me after the presentations and I can take your details and get in touch with you on that. But obviously underpinning all of this work and activity is the emphasis of working through and with our regional and centre colleagues to learn about local activity and listen and respond to local authority needs. So you've heard about what we're doing. We need to learn more about what you're doing. And this slide shows some of the issues that we need to consider. Obviously I'm not going to go into all of them, but the importance of working together locally and nationally, utilising your experience and expertise to make the most of opportunities, and looking at activity that you have done and how we can get information to better produce briefings, interventions and activity to support and help advise your local communities. And we really encourage you to explore this in this afternoon's workshop sessions on these areas. So finally, I'd just like to thank you for your time, and I'll just hand over now to Howell and Caroline, who will talk about the resources available from the Obesity Knowledge and Intelligence team. Thank you.